Welcome to everyone who's joining us in person and online via Teams and Avaya. Thank you for joining in early. My name is Mugure Githae. I'm the Research Education Fellow at the CAHS Research Education Program. I'd like to begin by acknowledging the traditional custodians of the land on which we stand, the Nungawajuk people, and pay my respects to their elders past, present, and future. So just a brief introduction to the CAHS Research Education Program. We run about 25 seminars in the year. These are usually on Fridays, select Fridays of the month, and they run for about 1 hour. Once you sign up for the seminars on Eventbrite, you receive a link to a handout, a PDF copy of the handout, which has got extra resources on the topic. So we try and cover all the small research topics that one requires to know, and we put in extra information of links you can access at the tail end of the handout. All these seminars are recorded and they're uploaded onto our website where you can access them after the seminar or after the workshop. We also run some workshops. And for purposes of this recording, as we run this seminar, we'll ask that if you have questions, you hold them towards the end of the seminar until you're given a chance to either ask the question in person, or for those who are online, you can type it out and Karen will ask on your behalf. When you're asking a question within the room, I ask that you please use the microphone so that the people online can also hear. So today we'll be talking about the use of REDCap for data collection and management. And I just want to give a disclaimer, this is not a demonstration of how it works, but more or less showing you what its strengths are and what the features are so that you can know how you can leverage it for either your research project or your clinical registry or for whatever use you require it for. And I'll just give a brief overview about the guidelines that are related to data collection and management. So we must start with a bit of the theory and the legal stuff, but I promise it won't take too long. So in 2016, there were some principles that were published, which are the FAIR Guiding Principles for Scientific Data Management and Stewardship. And they said that data should be fair. It should be findable, meaning that it's indexed somewhere and it has good metadata around it. It should be accessible, such that once you retrieve it, once you find it, you're able to retrieve it. It should also be interoperable, meaning that it follows the commonly used metadata standards, that it's in the language, the format, and the vocabulary that's easily identifiable to all, both for the data and its metadata, and that it's reusable, that it doesn't lose its initial richness once it's reused. For example, your results don't lose their initial richness once you're writing a publication. So it should be findable, it should be accessible, it should be interoperable, and it should be reusable. So I want us to see by the end of this, does REDCap meet those standards for that? And the whole aim of this is that we're trying to ensure the efficiency of the research process. How do we organize and document our data and make sure that our research process is efficient? We also want to be able to collaborate. We say that data should be interoperable. Different people should use it. They should be able to access it. So then how do we manage it in a manner that allows collaboration? It's also a necessity for funding. If anyone has sought any research grant, you need to be very clear about how you're managing your data because it's a key element. And we need to be able to enhance data security. How do we protect the confidentiality of our patients? We may be collecting sensitive information that even as individuals we would not want out there, and ethically for our research process, we must be able to enable data security. And then remember that when you've got shareable data, then you allow people to conduct audits on your work or on the clinical process. Gone are the days when we had many floppy drives and trying to to compile our data. So now we have more advanced electronic ways of collecting that data and managing it. And the data management process involves initially data collection. We'll look at how REDCap plays into that. And then once you've collected that data, how do you store it? How do you account for version control at the point of your data collection tools? Who has access to that data? How do you protect the security of the participants, the study participants, or your clinical patients in your clinical setups? And security also involves the network security. How secure is your network, the server that you're using? What are your system security measures that you're going to implement? And then how do you back up this data? It's always wise to have a copy of your data, so how do you back it up? How do you enable that people can share data? Going back to the FAIR principles, data should be interoperable, it should be reusable. So then how do you enable that your data can be shared? What are your archiving policies or SOPs, and when do you dispose this data, and how are you going to dispose it all? And what ties up all these steps is quality assurance, because at different stages, you should be able to conduct quality checks to ensure that your data is of good quality. So in Australia, we are guided by the code, the Australian Code for Responsible Conduct of Research, and it's not a big thing that should intimidate us into compliance, because it's pretty straightforward on what is required for the institutions and what is required for researchers. The institutions must be able to train their researchers, not just on the research processes, but also in terms of data collection and management. If they are providing a method or a software for data collection and management, then the researchers should be able to have training from their individual institutions, like we're having, about how to use that software. The institution must also take ownership of that data and control the research data and primary materials. The code also says that the institution is responsible for storage, so must have a secure system, retention and disposal of the data. It's also responsible for ensuring the safety and security of the participants and that their confidentiality is upheld. It must also provide measures by which interested parties can access this data, just as is required with the FAIR principles. As a researcher, what's your responsibility? You must have a data management plan in your protocol, and this will, one, ensure security of your patients and confidentiality, that you adhere to your institutional policies and procedures, and you must describe what your data management procedures are going to be. Do you require any licensing agreements if you're doing collaborative research? On whose server will the data be stored? And what does that mean for the collaborating institutions? What's your plan to train your study team members? It has to be something elaborate that comes out in your protocol. And then, of course, you must have your data collection form or forms. And then how are you going to retain this? And what are your dissemination protocols or agenda? So in all of this, I like what Stephen Covey says in his book, The 7 Habits of Highly Effective People. I think it's rule number 2, begin with the end in mind. Because if you know what you want your research project to answer, or the question that you want it to answer, then you can be able to determine what are you going to collect and how are you going to collect. Otherwise, you end up with a whole load of information that you don't necessarily require to answer your question. So in view of that, you must consider your research objectives. Each objective, ask yourself, what do I require to collect to meet this objective, to answer this objective? And then that will lead you to determine the type of data that you require to collect. Do you require categorical data? Do you require numerical data? Are you doing qualitative data collection? So that will determine the type of data. And the type of data is going to also influence the method that you're going to use to collect the data. Are you going to use a paper-based system or an electronic system? Are you going to use a combination of the two? How are you going to store this data is going to be influenced as well by how you're collecting. Your storage of paper records is going to be different from the storage of electronic records. And then how are you going to analyze the data? Because you want to make your process as easy as possible. For anyone who's analyzed data, you know that you would like it to be as smooth process as possible, so that you spend time in the statistics bit, but not in getting the data into the software that you're going to use. So all these have a role to play. If you're picking a piece of electronic software that's going to help you in data management, that includes your data collection, how easy is it to integrate into your statistical package or your statistical analysis package? So as a researcher picking the software, you must be able to think about your study flow. Are you collecting data using one data collection tool? Or is it going to be the same tool that's administered to the participants at several points in the study? Or is one participant receiving 3 or 4 data collection tools? So how does your software help you to be able to get this? That you're going to give this tool at the initial, 3 months from now, you issue the same tool plus another tool. 3 months from then, you issue 3 different tools. So you have to think about your study flow as you're thinking about how to set up your data management system. Then who's going to access this data and who's going to be collecting the data for you? Do you have part of your research team members who are going to be entering the data? Or are your participants collecting the data themselves through a survey, a self-administered survey? Or are you having a combination of the two? Perhaps initially, like in your clinic, you might write up the demographics of the patient. So that's a research team member who's putting in the data. Then you send out survey to your clinic patients. So that's a self-administered survey that they can do electronically or manually. So you've got different users, and why that matters, then who's going to have access and what kind of access that they're going to have. If it's just your research team that's involved with data collection, then you can limit the access to the research members. But if you're having members of the public involved in data collection, then your access needs to be public for that data collection too. You must also consider your statistical analysis plan. Like we said, it has to be integratable with your data collection system. And then what's the time frame? Because in your data collection, you must consider testing. Test and test and test before you deploy to the actual data collection. That means training people, and when you train people, you may see errors within how you had set it up on REDCap or whatever software you're using. So that will help you to make it easier for the end user. Why are we belaboring all this? It's because quality is never an accident. It's always the result of intelligent effort. And if we put in garbage, we get garbage. We're not going to be able to get outcomes without putting in quality data. So that's why we are belaboring the planning process. So what is REDCap? It's a web application. It's a web-based application that was built in the year 2004 by the Vanderbilt University, and it's been used for managing online surveys and databases. It's not open to individual access, but rather people access it through either four ways. There are institutional partners who are partners with REDCap itself, of which include the Western Australia Department of Health, as well as other research institutes like the Telethon Kids Institute. Most of our local universities are also institutional partners. So you can access it by being a member of those institutional partners. Non-governmental organizations can also access REDCap, being members of the REDCap consortium. And there are other ways to access it, either through the REDCap Cloud, which is a fee-based system, or there are people who plug onto Vanderbilt's REDCap system in itself. So for purposes of thinking about reliability, REDCap has been around for almost 2 decades, currently in use in 6,500 institutions, with 1.6 million projects done and over 2 million users that have used it. So I can say that it's got some reliability in terms of that duration and at least the reports that are given. How then do you access it? We've agreed that most of us access it using our institutional instances of REDCap. For those who access it using the Department of Health, the Western Australia Department of Health, we use Data Library. For those institutes like TKI, they have their own REDCap instance. Universities like UWA, Curtin, they've got their own REDCap instances. So you can access it from your organizational-based URL access. And then it's got a secure individual access. Each institution has given its users a username and a password. And for the Department of Health, there's an extra security measure for you to access it off-site or off-campus. You must have set up a 2-step verification. So that's at least a secure system. And then for your particular project, you can further go and limit who accesses your project. So you can assign user rights depending on what purpose somebody in the research team is playing. For instance, as a principal investigator, I will have access to be able to design the tool to add or enter data entry to determine who accesses what, so I can set up the user rights. So I can have a whole bunch of these rights that are set up. But if I want the people doing data entry to only be able to enter and edit records, then that's all they can do. If I've got associate investigators who I want to be able to generate reports, then I can add them up and give them that ability to generate reports. If I have a biostatistician on board, then I can set up that all they can get is the data that has been entered, but they cannot add or enter any data. So literally you can restrict who accesses what piece of the data and at what point of the data management process. And then there's the ability to even go further and set up who can access specific records. If you're doing collaborative research between 2 institutions, you may want to limit the access to patient records to people of a particular institution. For instance, if we are doing a study at the Park Children's Hospital in collaboration with the Royal Children's Hospital in Melbourne, then we can limit access to the records that are from PCH to just the study team from PCH, and that will form one data access group. And then the people from Royal Melbourne will all be able to put in the Royal Children's Hospital, will only be able to put in and view records that were put in their site. So that's another way of limiting access. What happens if you have data collection in areas where internet access is a challenge? REDCap has a mobile app that's accessible on both the iOS and Android systems. And what this allows you to do is to collect data offsite. Basically, as the project manager, you'll upload your REDCap project onto some tablets or mobile devices, and then the people offsite are able to enter their data. Once they're within internet connection, this is automatically uploaded onto your REDCap project, which is hosted on your institutional server. So that's a good capability for where perhaps you're doing research and you're collecting data from sites that don't have internet connectivity. Having seen how you can access REDCap, then how do we navigate once we're there? When you're choosing a software, you want something that's user-friendly and that's easy to understand. And for REDCap, this has quite an intuitive user interface. On the left-hand side is a menu, which basically gives you quick access to some of the functions you may require, some of the applications and some of the steps that you do. And then on the right-hand side is a dashboard area. At the top end is the logo, because the different institutions are going to customize their REDCap instance based on their institutional policies. So this one is an example of how it appears on Data Library REDCap instance. So it has your project name, which is unique to your project, and the project ID is the reference number that your REDCap administrator for the institution will be able to use to access in case you require any help. It's the unique identifier of your process. And then there is that project setup that basically acts like a checklist. It's always good to have a reminder of what you require to do, and I think this is quite a good thing because it tells you you've done this step, you can move on to the next step. You need to do this before you can finally move to collecting data. So it's able to act like a checklist, and you can see that there are areas, let me see if I can put on the pointer. So you can see like the areas there, once you're completed, you can just click I'm done, and that changes into a green tick box. So it acts like a checklist system. Then you're able to customize your setup. If all you're doing is having data collection done by your research team, then you don't require surveys, so you don't have to set it up. If you're collecting data at different points in time in a longitudinal project kind of way, then you can set that up. It takes you then to the next step, which is how to design your data collection tools. In REDCap, they're referred to as instruments, and also how to set up your surveys. So this enables you to be able to learn how to set up your surveys. At every point, if you cannot even up here, there's a video where you can be able to get help on how to navigate that area. If you're doing a longitudinal kind of study or project, then you're able to define the events. Are you going to see your participants after 3 months? You can set that up and see how to be able to assign particular data collection tools to those particular events. So it's also good for a longitudinal study setup. If you're doing a clinic, maybe where you're following up your diabetic patients and you want them to come every quarter, you can set that up and be able to follow through with them. Then it's also got optional customizations that allows you to use the same instrument, which is a data collection tool, at different points, so you can repeat it at various points in your project. It gives you the ability to auto-number your records. It generates a unique ID so that even if you're having data entry being done at multiple sites, it can be done concurrently without you wondering or bothering about how the record numbering will be done. I'll elaborate a little bit about the scheduling module. If you're running a randomized controlled trial, then REDCap gives you the ability to be able to set up your randomization within REDCap. And then if you're running surveys, you can designate an email field that you've put up to be able to send out the survey. So there are a lot of customizations that you can do so that the system works for you. The software needs to work for you. Occasionally, you've got links to some web pages that you require within REDCap. So you don't want your user or the research team member to keep moving from REDCap to a web page. So you can put up bookmarks such that once they access the project, then they also have access to those bookmarks or those web pages. And then, like we said, you can set up the user rights and permissions. Remember, at this stage, every point that you complete, you can put a tick, so that you're not executing your project data collection and then realize I hadn't set up the user rights. So there's a reminder in form of a checklist. It reminds you to test your project thoroughly. You don't want to get to data collection and realize, I forgot to capture the height of these patients. You want to test thoroughly and to be able to integrate it while still in the design phase. So all this is done when they're in the development stage. And for REDCap now, once you start the actual data collection, it's recommended to move to the production stage. In the production stage, you're not allowed to, or it's a longer process for you to make changes. In the development stage, if you make a change, it's implemented immediately and you can see the effects of that change. So this acts like a good checklist, and once you're done, it tells you you're good, you can move the project to production stage. Like I said, it's quite user-friendly. You're able to get help at different points, which is easily accessible at the top of the screen. And all you have to do is type in the question that you have, and you can get your answers to specific questions. And how do you do that? Like, for instance, if you wanted to learn about branching logic or field embedding or how to do calculations on REDCap, you simply type in the question, and it will show you the various stages of the project design where you might need to use this feature, and you simply select where you want. If you wanted to do it in data design, the collection, the instrument design, then you can just do that, type it out, and get the help from the manual. If you prefer to watch videos, there are videos available for each of the modules or the features that it has. And all it takes is watching them, and you can work alongside them. If you've got two screens, you can open the video in one and have your project on the other. So literally, you're able to teach yourself how to do REDCap. But if you require some more, we do run workshops that run the entire year. So let me just throw in the promo there. So we've looked at how we access it, and you've seen that the interface is quite intuitive and we can be able to use it. So then how do we use it for data collection? There are about 5 ways. One is from the web browser, where you access on the URL of your institution, and then you can use it for data collection. I'll just show you a few snapshots later. And like the second one we've said, you can use the mobile app. So your members of the research team can collect data for you offline using the mobile app. You can also import it from a CSV or XML format. I'm aware that part of what we were using previously to collect was spreadsheets. So this can be saved in that format and then uploaded onto the REDCap, so that you're not again going to re-enter data that you've collected for the last 10 years in a spreadsheet. So that's one other method of data collection. There's a feature of REDCap that's called My CAP, which is basically for the participant, that the participant can enter data for themselves, but using an application. And this app helps them to also be able to communicate with the research team. Like you can get reminders. So for patients who maybe you want to see more frequently, but you require them to enter some information about themselves, then you don't have to keep having them come into the clinic. If they are able to get the app, then they can get the app, and that allows them to enter information even if they are offline. Once they're within an internet connection, it's immediately uploaded onto your server. And then there's still the ability to print out a PDF form of your data collection tool. Just recently in one of the workshops, I had a participant ask me, her clientele is senior citizens, and they're not able to have access to like even the link or the internet access. So she still requires to use data collection for that subset of her population. So it's as simple as printing out from the PDF and then giving them to fill, and one of your research team members or yourself can upload it onto REDCap. So you're doing a hybrid form of data collection. So I think it's quite diverse in terms of the means of data collection that you can use. Then you have to consider, as you're setting up your project on REDCap, what are your data collection tools? Are you going to use a form? A form in REDCap is what the research team members will put data into. Or are you going to give your participants a self-administered survey? Or are you going to have a combination of the two? Then think about it this way. Are you collecting data at one point in time, meaning that it's a classic study? Or are you collecting same data from one participant at different points in time, meaning is it a longitudinal study? Once you have that in mind, then you can then set up your data entry form. The data entry form is what it appears like to the research team member who is accessing it using the web-based application or the REDCap mobile. And as you can see, it's quite simple. It's a text box for the name. You're able to select the date. You can set up whatever questions you require, and there are options for them to save and even to lock records. If the survey is being given, if the same tool is being given to participants to administer as a survey for themselves, that's how it's set up. You can see you can customize it. It appears the same like it would on a form, just with a little bit of more instructions to the survey participants. When you think about your data variables, REDCap allows you a variety of fields that you can use to collect that data. So if you want someone to type in, then you can use a text box. If you would require some more elaboration, because sometimes we are trying to get like an in-depth analysis, there can be a paragraph box. Do you want calculations done for you? REDCap allows that to happen. Do you want your users to select a single answer from multiple choice questions, or do you want them to select multiple answers? You're able to get that. Do you want them to append a signature? If you think about setting up a project where maybe you want the head of department to be able to sign off on something, so you can set it up as the admin, gather all the documents, prepare what is required, and send it to them, and they'll be able to append an electronic signature. Do you want to add a visual analog score to your surveys? So REDCap allows that. Or do you want to provide, like perhaps for survey participants, you've recorded a video where you want to give like a definition of how the research project is running. So you can append that at the top of the survey and explain to your participants in the study, this is what we're looking at, this is how we're going to collect data, this is what the data will be used for. So it's quite robust in its use. Now, this is what it appears. I know when we think about software, we think of a lot of coding. I'm not into IT and programming, so anybody can use this. And I just wanted to illustrate how intuitive it is if you know what it is you want to set up. The field label is what you want the end user to see. So like now, if I want them to put in a guest name, I can type in, please key in the guest name. And the variable name is how REDCap recognizes it. So you're just giving it something that's easy for you. If you think about a spreadsheet, you don't want to have columns that have column headers that are very long. So it's just something simple like name. And then do you want this field to be a compulsory field, meaning that you want to trigger whoever is entering the data to enter data about this thing, that they cannot leave a blank field. Anybody who has analyzed data knows how frustrating it is when you've got missing data. So this is a good thing that you can set this up at the point of data collection. Again, for ethical approval, you want to keep anything that identifies a patient confidential. So this helps you to be able to sort your data and know that this has got a patient identifier, so it cannot be accessible to people who do not require to know. For instance, I may not want my statistician to have patient identifiers. I just want them to have the data that's going to lead to results. So then I can put this, and every time that a patient identifier is put in, there's a trigger that this one cannot be accessed by so-and-so. And then you can give additional instructions to the people. Let's say that you wanted to give a format in how the data is to be collected, you can give that there. Sorry, and then that's for individual fields. The field is like the cell where data is going to be collected. How about if you have many fields, but they're having similar responses? You can congregate this into a table. Instead of having 4 different questions, each having 7 options for answers, you can congregate this into a table, and this is called a matrix of fields, which again shortens your project, which is good for whoever is entering the data. I'll just elaborate a few design capabilities that it has. Let's say you're entering dates of like a particular date. Someone could write it in an American format. Somebody else could write it in the UK or the Australian format. So you can set this up. Why? This helps with your calculations, and also at the point where you're analyzing and you're cleaning your data, you want it already validated. So previously, we would validate data at the point of cleaning up the data after data completion is done. I mean, data collection is complete. But now you can set up data validation at the point of data entry, so that if someone enters data in a format that is not desired, they get a trigger that they have to put it in the right way. How many times have you put a text box for data and somebody writes in at age as 13 years, someone else writes it at 11? So at the point of cleaning data, you have to decide, I want this all in a numerical format. So then you have to go changing this from 13 years to just 13, the number 13, or what you can have it done is just simplify the process by doing this at data entry. so that you have a standardized format of putting everything. If you want people to put it to 1 decimal place, have it to 1 decimal place. If you want them to round up to 1, then you can set it up here that it's just having a number, not an integer. So all those are the things that help you to be able to simplify your analysis process by taking time in the planning during design. And then it allows you to also apply branching logic. You want to conditionally show and hide fields based on the selection of a response. If I have questions that are particular for the female gender, then I don't want a man to be able to access them, maybe about their last menstrual period or their menopausal status. A man, that's not relevant to the male population. So then that's what branching logic allows you to do, that you hide the questions that are targeted at somebody who picks as a particular response. In this instance, I was collecting data about dietary preferences, and perhaps for someone who's vegetarian, that was all I required. But then there are people who have dietary preferences that are not listed there, so I had the other option. And I want those who click other to be able to see these other specific dietary requirements like gluten-free and the like. So I hide that for the other 5, but it's visible only for the people who select other. And that's a good feature with REDCap, so it helps to shorten your survey instrument or your data collection form, which helps to get better response rate as well. Then you want the software to do as much as it can for you. Are you going to have your research team member take the weight of the patient and the height and then sit down and calculate the BMI, the body mass index? Or are you able to put in an equation and the system calculates it for you? Think about some of the scores that we use. Maybe it's a critical care score. As long as you have the equation, you can code this onto REDCap. And once the initial main determinants of that equation are put in, then there's a cell that you have where it will give you the automated response because you've put in the equation. So it simplifies the work of the research team. If you're collecting data in a longitudinal project, then it means that your client or your participant is coming at different points in time. It would be essential for them to know when they're coming. You may have said that I'm going to see you every 3 months, and perhaps you're enrolling patients at different points in time. But your follow-up clinic for these study participants is held on a Tuesday. So you can collect it in such a way that, yes, they were enrolled on a Friday, but I want to see you after a month. And the month, I'll give it a range of maybe 5 days. So if you come within a Tuesday on that day, and you can set it up, print out the schedule for the participants so that they also know when they're coming back, and then you can be able to give that to them. For your team members, you can actually then collate all this for longitudinal studies and set it up in a calendar so that they know on a particular date we're expecting 10 study participants because we were enrolling at various points in time. So it's a good way, and this now is also able to be linked with your other calendar systems like Outlook, so you can download it and link to the Outlook if you have like a group email or a group inbox that you can access. It's beginning to feel like a sales pitch, but I think it is, so that you know why the Department of Health picked it for us. Have you ever had like instruments that are common in your specialty? Maybe you're doing critical care and you want to look at the agitated behavior scale, for instance, or mental health, something of the sort. Somebody already has a validated tool on this. You don't require to go in and type again coding or design it into your project. I like simplifying my life. Even in the tools that we use in the house or even in the car, you want something that's going to just assist you. So somebody has already done this and they've shared it onto the REDCap library, which you can search and say, I require this and this tool for my assessment. Is it available? Yes. Then you can view it as a web page and see, does it actually reflect the tool that you want to use to collect your data? And if it does, it's as simple as importing it onto your REDCap project. So you don't have, again, to recreate that. If you're collecting demographic information, some people have uploaded some demographic instruments. You can see whether they fit your scenario and then just upload it onto your project as one of your instruments or as your main instrument. Within the REDCap shared library as well, you can access some of the common instruments used in different languages. In one of the previous workshops, I had a participant ask me about, this demographic information we are collecting, is it in Chinese? And went and looked it up, and it's there. I'm not I'm not fluent in Chinese, so I don't know if it's legit. But again, that's on you to look up and see, does this meet what I want? Instead of you having now to go again and code it in and translate it to Chinese, someone has done the work. It will save you some time that could be better used doing something else. So there's access to a shared library that's got a whole load of instruments that you can use. Then for your surveys, when you issue a survey to someone, I guess the difference with having them in person is, in person you can be able to see, does this person meet my selection criteria? When I weigh my inclusion and exclusion criteria, does this person meet my selection criteria? So what happens if you shared a link to several people, but you're not there in person to be able to select who meets the inclusion criteria? So you can use the survey stop feature. What it does is that you have put a question or a series of questions that are part of your inclusion criteria. I'll give an example that's in the background there. I wanted to only study patients who reside in Western Australia. So my first question was, do you reside in Western Australia? For anyone who clicks yes, they proceed to the second question. But if you click no, a pop-up box comes and tells you that you've selected an option that triggers the survey to end right now, because my exclusion criteria was people who do not reside in Western Australia. And then it's good, REDCap is good in the sense that it has a fallback mechanism, because sometimes you accidentally click on something. So it actually tells you, are you aware, do you want to return and edit your response if for real you reside in Western Australia, but it was an erroneous click? Or do you actually not reside in Western Australia, so you can end the survey? So it's a good way for you while issuing surveys to be able to have your inclusion criteria and just use the survey stop feature to stop that if the inclusion criteria is not met. Still with surveys, maybe you require extra information from people who are taking part in the survey, so you can ask them to upload a file. If your patients are out in the community and maybe their blood pressure is charted elsewhere, instead of having them come into PCH for just something that can be done out in the community or at the GP, they can upload, for instance, their blood pressure chart. If you wanted a vaccination or some lab results that they have done, they don't have to travel to you, they can upload the file there and you'll be able to see it. Again, with surveys, there is the consent thing. There's implied consent where you give your survey instructions and say, by answering the questions, you're agreeing to participate in this study. However, you have an option to actually have consent by setting this up in your survey settings, and it gives you the option for the end user, one, to see the results that they have put in, confirm as true. If not, they can go back and change the responses. And secondly, to certify like a sort of a consent that they have, this is me agreeing and this is equivalent to an electronic signature. So it has that consent ability as well. From a branding and customization sort of way, you can customize it however you wish. If you want to put your logos, if you want to put videos, if the branding of your organization is particular colors, you can set up your survey to meet that. Then you can also personalize them. Who doesn't like to have an email that's addressed to them instead of dear user, you know? So you can put in whatever you want through a feature called piping. Piping basically retrieves information that has previously been entered and displays it in the place where you want. So since here we had entered the name of the participant as Ryan, now when I'm sending out a survey, it picks up that and gives it that personal touch to it. As you can see, the tool appears just like it would with a data collection form. When you think about your survey distribution, REDCap has ability to help automate your survey invitations. You do not want to be writing out a survey invitation for each survey participant. So if you have already captured their email address, then you can use that email address and automate your survey invitations. And like you can see here, I picked a longitudinal study to give you as an example. For each event, you can actually automate that invitation if you're collecting surveys from different events. So you just set it up, and then once you set it up, you can give instructions that this survey should be sent after 3 months or on a particular date and time. Maybe you think that most guys check their emails at 7 in the morning. So for a good response rate, send it out at 7 a.m. and then send a reminder after 48 hours. REDCap is very kind. It doesn't allow you to send more than 5 reminders. So you just send 1, 2, 3, 4, 5, and that's done, all right? So that helps to improve your survey response rate because you want to get good data. What if you're just issuing surveys to the public? There's an option. Remember, we said the use service is intuitive, so you can just come to survey distribution tools, and when you click that within the dashboard, it gives you ideas of how to use it. Do you want to give a public link that you share within a group email? Like if you're using to the registrars, you can share a link and just share that, or to your department if you've got like a list of the emails. Or do you want to shorten it and customize it as you wish? Then, if you've got access to the email addresses of the people that you require, you can set up a participant list. So within there, you can have a list of participants where you just copy and paste their email addresses. We are trying to make this as simple as possible. And once you've added the participants now to that list, then you compose one survey invitation that will be sent to them. Again, this survey invitation is going to be sent out at the, you can set the, you can schedule it and set when you want it to be sent out, at what time, if you want to put reminders and how many reminders that you want. From a point of also being the project manager or the PI, you can still have a survey invitation log so that you can see that I sent out this survey to 100 people, 45 of them have responded, reminders have been sent out to 25 of them, or maybe the remaining 55. So it gives you that. And eventually you can still export the list if you want to have it for your records, that these were the people involved in the study and these are their contact addresses. But the responses of the respondents remain anonymous. All it's telling you within this log is that I sent out an email to XYZ, they have filled out the survey and they've completed the survey, but XYZ has not completed. So REDCap will again now send to only those who have not completed. How many times have you been filling in something and you're not sure how much longer you have to go? So maybe your participants have got 4 or 5 tools that you're requiring to collect. I'll give an example, like maybe you're using it for auditing a particular process with hospitals in the community. So what do? You set it up from here and send the link to the in-charges or the nurse managers in those facilities. But they require to know how many tools they're going to have. So you can have that in a survey queue so that they know you've done one, you've got 3 to go. It helps them to be able to plan their time. Maybe right now is a busy time. They say, I can do this tomorrow. I can do this in the afternoon. And it's easy because each survey can be accessed by quickly clicking on that. So then how do we, again, leverage on REDCap's facilities for data export and visualization? Once you're done with your data collection, you can export it either in a spreadsheet format, that is the CSV form, or directly to a statistical package. This was made for researchers, so they've actually looked at the common statistical packages that are used, and now you're able to export them, so there's compatibility between REDCap and these statistical packages. Again, you can de-identify information. I may be exporting it to a spreadsheet for myself, so I can have the full range of data as the PI. But when I'm giving it to my biostatistician, I can de-identify the data just using the options that are available here. And it's as simple as just clicking on the export data button. What if you want to visualize it? You can visualize it as tables by simply clicking on View Report. You'll see the full table of all the data you've collected. If you just want to know specific things, you can customize your table by making a custom selection where you create a new report. If you want to view it as simple charts and basic statistics, then you can also see it by clicking on the Stats and Charts button. And this is how it appears like. For those of you who run projects and maybe you need to give like quarterly or semi-annual reports, then you can just pick on this, like just download the image and copy paste it onto your PowerPoint presentation or onto the report that you're doing, because it gives you like a quick snapshot of where you are. It just does basic statistics like the measures of central frequency, like the mean and the mode and the median. Not complex analysis. I'm not gonna oversell it here. So for you, who's the project manager, how does REDCap help you? There are 3 stages. The development stage in REDCap is where you're designing. You design your tool, you test it, and then you decide who's got access to it. Once you're done and you're ready and you think now we are good for data collection, you move it to the production stage. Now, in the production stage, if you make a mistake or you realize you have an amendment to make to how the tool is collecting data, then you're not going to get real-life changes. These have to be made in a draft mode and then approved by the REDCap administrator. So depending on your institution, this may not be immediate. So it's advisable that you take time making all the changes that you require while it's still in the development stage. so that once you move to production, what you're doing is now data entry without making changes to the data collection tool itself. At the production stage, you're also able to do quality assessment. I'll just show you a snapshot of how you can do that. You can check the integrity of your data. You can run some quality checks. You can have reports, and you can also export the data as required, either in spreadsheet format or in any other format that you require. Then once you're done with data collection, you move it now to the analysis or the cleanup stage. At this stage of REDCap, you're not allowed to collect data anymore. You can clean the data, put in the codes for missing data or the likes, but you cannot collect data anymore. So that's a good security check for those who are in project management. And then it also allows you to export it to the statistical packages as you require. As a project manager, you want to know who has done what and when they've done it. And you can see from that, again, an easily accessible bit is the login app. And it tells you that on this date, at this time, this user made this action on this, and this is how the data changed. So from a project management point of view, that's automated for you, and that's a good feature for it to have. Do you want to run quality checks at some point of your data collection? Again, it's just a click of the button, and you can be able to select maybe from the predefined list what do you want to check for blank values. In case those were optional fields, you can look for that so that you can know how to code them. Or if you want to check the calculations, are they running okay? You simply click execute and it will tell you how it's running. There are instances where you may see that there's a challenge with your calculation, and in the data design or the project design, you can run and make a change to it. But once you change, if you had any other data that was there entered previously, you want to employ the new calculation into that data. So that's where you come and do that at this calculated fields, the H, incorrect values for calculated fields. You execute. It will show you that based on your new equation, these are correct and these are false. Then you can execute that and employ the new equation into the previously entered data at the design phase. You want to be able to back up. Everyone knows the essence of backing up, and REDCap allows you to store your data plus the data about the data, which is the metadata. That sounds like a rhyme, yeah, but it allows you to store both download both the metadata and the data, and you can save that, which as a project manager, you'll agree that's an essential thing. Every other time you're getting system modifications, it's always good to have a backup of your data in case something happens with the system, you've got a backup. We must talk about project migration because we are moving from places of individual institution research and doing multi-center research or studies or registries. So you don't have to duplicate what has been done in another facility. If you're coming on board as a collaborative institute, all they have to do is for them to export the REDCap project, give you the form in which it is stored as an XML for that project, and on your end, you just upload it. And that you don't have to go again designing the tool to look similar to this. So if you're going to have similar variables that you're collecting, it's as simple as just hitting export, and then come and create your project and export this. This we cover in our REDCap intermediate workshop. What are some other applications that we can use? In a setup where we've got a linguistically diverse population, then you must be able to have a multi-language management system whereby the feature actually shows that data entry form or the survey form in multiple languages. So you allow the end user to select that I want this in French, and basically you've put the formats that it's translated to. You as the person designing the project will be able to translate bits and pieces of the form that probably can be better expressed in other languages, things that are common, like if it's numbers, they're similar, but there are some things that differ in other languages. So you give the user an ability to select that I want my form in French, and then the form automatically changes to French. It's the same data being collected, but in a different format in terms of what the end user is seeing. I've put a link down there. If you watch the video, you'll be able to see how to use that for your project. Decide whether or not it works for you, because it's not an automated process. It's not going to auto-translate your tool. Again, I don't want to oversell the software, but it's for you to click, but it shows you how to do it and gives you suggestions of what the translation could be. Then REDCap allows you to set up alerts and notifications. Yes, we talked about automated survey invitations, but those are for surveys. How about if you want, when a particular form is filled, you as the PI gets an alert that this form has been filled, so now you need to do this. Or perhaps you're doing, as the PI, you want to verify every data collection tool that has been put. So when your research assistant puts it in, they can mark it as unverified, and you get a notification that this record has been put in. So you simply select the link, and then you're able to go through the form, say it's okay, click it as complete, and now it will be stored as complete. Or if you have a team that you want to alert that somebody has probably requested for support from our team, every time that request is put in, you can set up and send this alert to multiple people, not just one person, one email address. You can set it up to multiple people. So you can think about that if your way of engaging with your consumers is in a way that requires notifications to your team, your primary team. And then it's got other functions. Yes, we can copy and paste the graphs from REDCap onto our PowerPoints, but we are in the year 2023. There's a lot of technology. The business intelligence unit, like here within CAHS, is dynamic. Now we're using Power BI, and all these things can be put on a dashboard, which will simplify your work if you're managing any project. So they basically use this REDCap application program interface, so the REDCap API. They get a token, and every time, like, you can decide on how frequently it's going to be set up or refresh with the Power BI, with the BI team. And then they just picks data from REDCap and displays it on a dashboard. I'll speak from experience. It has simplified my work when it comes to reporting, because I can just get my updates daily, know what our numbers are, how many of you are logged in, how many of you are accessing our videos or our handouts, who's using what topics are of more interest. So it really helps from a research point of view and from a project manager point of view. There are people you want to issue surveys to using SMSs. So this is a paid feature using Twilio, but you can still use it and be able to send out to them. And then there are very many external modules. I can't elaborate on all of its features in 1 hour, but just believe me, like, even if you want to copy or rather view an image that was uploaded or a PDF file that was uploaded, and you want whoever is entering data to view it in one format, instead of having to go back and check that this record had got 3 files uploaded, you can pipe that, move it from where it was put, and for the person now doing the secondary data entry, they're able to see what was previously entered. So there are many, many features that REDCap has. It does many things at the same time, and it's able to do a lot that we require. So why would you choose it? It would be unfair to just tell you all that it does without giving its limitations. If you're thinking about using it in a clinical setup, it's not going to support billing. So it's not an all-inclusive system. You may still need to keep your billing system and think about this from a research point of view or an audit point of view. It's not going to do crazy statistics. Don't think about your test of association and logistic regression. It's not going to do that. And it may not also be your best workflow tool, because it's not a fully automated process. There are things that will require manual intervention. If you require reports, you're not going to be able to do it off, like just as an automated process. It may require you clicking it manually to get those reports. As we said, now you can integrate it with Power BI and Tableau dashboards that you can use. There also isn't a link to EMR. I know there's a lot of work in play to be able to link it to our current EMRs. So with time, this will be a different story when this seminar is given, probably a year or 2 down the line. But I can say it's secure, it's free, it's user-friendly. You can learn it by yourself. If you require, once again, we hold at least a minimum of 9 workshops in the year. Feel free to plug into the one based on your level. It has both online and offline capabilities. It allows you to import and export data. It's good for collaborative projects, and it's continuously improving. There's a feature down there that says, suggest a feature for improvement. So they are actually willing to take this, because this was made for researchers, and they're the ones to improve it. It does seem like REDCap does almost everything for you, research-wise, not in terms of personal lives. I'm happy to take any questions, if you may have any. If you're in the room, kindly use the microphone so that those online can hear as well. Thank you.
Thank you, Jane. Wow, REDCap's got a lot in it, doesn't it? Does anyone have any questions here?
Thank you for that talk. Just want to ask, if we go into the production stage, how difficult is it to go back to the design stage? For example, we come up with a different variable that we want to look at that we didn't think of initially.
So you can't go back to the development stage. You can redesign, but these changes that you make are not going to be live. So think about it. Maybe you wanted to test a calculation. You put in the code and realize, I could have had this calculation run for me. In the production stage, you have to wait for the REDCap administrator to approve to know whether your calculation works or not, which is why we belabor the point of the planning stage. Test and test there, decide, give this survey to different people so they can see how user-friendly it is. So you cannot go back to the development stage. You can redesign your data collection tool, but the changes are not going to be implemented immediately. So whilst previously you could change the formula and check whether it works and see the change immediately, now you're at the mercy of the REDCap administrator and how they've set it up. So you have to wait for them. So you may be coding or you may be redesigning, and then you wait maybe 5-10 minutes, get the response, it doesn't work, do that again, submit changes to the REDCap admin. So that's why we say do it in the development stage. Yeah.
Thank you very much, Dr. Jen. Interesting, always learn a lot from your talk. Now my question is, when you talk about the collect data via mobile, who do we make application to get collecting data, authorized to get collecting data via mobile app?
So it's back to the institutional REDCap admin. So if you want to use the REDCap mobile app, that one you directly link to your institutional REDCap admin. So if you're using Department of Health, then you use the data library. So there's a feature on REDCap that says contact the REDCap administrator. So you hit that. It will have your project ID, which is listed at the top of the page. And then you can reference and say, we require to use the REDCap mobile app on X number of tablets. Then they can assist you with that process to be able to put it there. Yeah.
Thank you very much. I just had two comments, one of which relates to the mobile app, that within the Department of Health, not all health service providers are currently permitting the REDCap mobile app to be used. They have, however, given an undertaking that when we reached version 13, they would implement it. And it's hoped that in the next 2 months it will be available. Second comment was just to do about the visualizations, and you mentioned about Power BI. A lot of work has been done in REDCap on the project dashboards and visualization and a whole host of additional smart variables, so that quite a number of people don't actually have to go to Power BI to get that sort of project management visualization they want, and working in conjunction with some of the external modules, such as Report Scheduler, you can have it updating everything, publishing it publicly, etc. every day. And that's a lot simpler than going to Power BI and getting the API, etc., and perhaps having to get someone else to do it for you. Thank you.
Yeah, that's true. So you can explore the whole list of things. So I was giving that as an example because there are people who want to just do the basic bit of the project management. Maybe they're clinicians without a lot of time, so they can engage the services of the business intelligence unit. But through the external modules, like he said, there's a lot that you can use for report scheduling, for image piping. You can learn about the smart variables and how to use them. Like if from an individual you're well versed in that bit of IT and project management, then you can do that for yourself. For systems where they want to integrate them with their business intelligence unit, then you can still do that. And I mean, it works either way. It's quite versatile. But thanks for that. Okay. Thank you. I just want to highlight that next week we'll be having Ken Lee come, and he'll tell us how to leverage social media as researchers. And then the following week we'll have Associate Professor Sunaline Davidson come and tell us how to use or to get the most out of our research supervisors. And at the end of the month we'll have Dr. Tamika Hayden come again and give us an insightful topic on research impact. In your emails will come a link to a survey, another REDCap survey. Please fill it out and let us know what you liked, encourage us, and if there's anything you'd like to see different that we could improve, we're happy to improve. Thank you.